Canada's chief public health officer warns those new variants threaten to derail the work being done to cut the number of cases and hospitalizations. At least 3 provinces are reporting evidence of community spread involving these more transmissible variants. Today, Manitoba loosened some restrictions. Gyms and restaurants can now open to 25% capacity. And as Heather Yourex-West reports, some in the medical community fear a third wave is coming unless we change course now.
A chance to visit a restaurant or send kids back to school has become a welcome bit of respite for the pandemic weary. Canada appears to be coming through the second wave, and the appetite for normalcy is strong.
The combination of that optimism from a successful lockdown leading to governments wanting to reopen, and the background of these variants of concern emerging, plus delays in the vaccine arrival, is setting up really this perfect storm for a massive third wave.
Ontario modeling shows that without stronger restrictions, new variant cases will grow exponentially in the coming weeks to well over 1,000 daily cases by the spring.
If the B117 variant behaves as it did in the United Kingdom, cases will start to grow here again in late February or early March. That is, unless we can limit the spread through public health measures.
And yet, Ontario is easing restrictions. Alberta, too, even as the number of variant cases in that province increases by the day. On January 8th, Alberta had detected 5 variant cases. Just 6 weeks later, on February 11th, there were 156, 96 who did not travel.
We are screening all of our positive cases for variant strains so that we're able to put more intensive intervention around those cases and really treat our variant cases with a containment approach.
But some in the medical community believe the opportunity to contain these new variants has passed. Modeling out of the University of Calgary suggests that the variant first discovered in the UK could be the dominant strain in Alberta by March.
Given the doubling time of the cases of the new variant that we've seen in Alberta over recent weeks, I do believe that we are approaching the potential of a third wave if we don't take further action now.
A difficult decision left once again in the hands of provincial leaders. Nearly a year after the first calls to lock down, the threat of COVID-19 is far from done. Heather Yourex-West, Global News, Calgary.
Every day, more cases of the new, more contagious variants of COVID-19 are being confirmed in Canada. The one first detected in the UK seems to be spreading the fastest. And since the variants are easier to catch, Canadians are likely going to have to brace themselves for even tighter public health restrictions in the weeks to come. Dawna Friesen is taking a deeper look in this week's edition of The New Reality. Dawna?
Robin, a key question is whether we've learned enough from what happened last spring. We know the virus thrives when we move around. It needs human hosts to spread and mutate. That's what's propelled the coronavirus to spread from China all over the world. These new variants are testing us again. They are spreading faster than the vaccines are rolling out. Yet there is no consensus about how to restrict how we move around.
We're looking at really every measure that's been implemented by every country.
I spoke with Professor Kelly Lee at BC's Simon Fraser University. She's part of an international group analyzing travel restrictions.
How do you think the conversation, the thinking, the strategy about travel restrictions has evolved from the beginning to where we are now?
So at the beginning, way back in January, February, the received wisdom really was that travel-related restrictions don't work. And WHO put out the recommendation that countries should not adopt such measures. As this pandemic has unfolded, we've seen that actually there are some situations where actually it can work.
It's worked in Australia and New Zealand, where life is largely back to normal because of tight border controls and strict lockdowns when even a single case emerges. That's one part of our story. Tomorrow, we'll also explain how labs in this country are hunting for the variants, why genomic sequencing is so critical, and whether enough is being done. Plus, the uncertainty about whether variants can reinfect those who have already recovered from COVID-19. Robin?
All right, good stuff, Dawna. To watch Dawna's full story, tune into The New Reality tomorrow night, right here on Global.